49-year-old nurse practitioner Marizel Yukee falsely billed Medicare $906 million for hospice patients, then spent the money on a Ferrari and Bulgari necklace. And remember, President Trump has this national initiative going on where he has created this national healthcare fraud takedown initiative and is going after a lot of these greedy individuals who have made fraudulent claims and made millions of dollars illegally off of programs like Medicare and Medicaid. So this Marizel Yukee, 49-year-old Filipino woman, is a nurse practitioner who is originally from the Philippines, who resided in Las Vegas, Nevada. She was indicted on June 18, 2026 in the Southern District of Texas on charges including conspiracy to commit healthcare fraud, wire fraud, conspiracy to pay and receive illegal kickbacks, and money laundering. And so here's the scheme. Ms. Yukee owned and operated 4 wound care companies named Wound Medic, My Best Health First, All Care Mobile Wound Treatment, and Oracle Wound Treatment, operating in Texas, Nevada, California, and Hawaii. Prosecutors allege that from October 2023 through April 2026, Ms. Yukee and her co-conspirators submitted more than $906 million in false and fraudulent claims to Medicare and TRICARE for medically unnecessary amniotic wound allografts. This must be a big thing in the healthcare community, especially for elderly people that get wounds that won't heal. This amniotic wound allografts. There's been several cases where people have had these companies and are falsely billing Medicare and Medicaid for exuberant amounts of money. So there must be a whole network of folks that are in this whole this amniotic wound allograft business. The program paid out more than approximately $297 million on those claims. Almost $300 million was paid out. She falsely billed for $906 million. It's a lot of money out there. And she averaged over $1 million in billed claims per Medicare beneficiary. So who were the victims? Prosecutors allege Ms. Yukee and her co-conspirators targeted elderly Medicare beneficiaries, many of whom were terminally ill in hospice care. So she is taking advantage of elderly folks that are sick and dying, and caused the grafts to be applied to those vulnerable patients. These terminally ill people she was applying these grafts to, and they didn't need them. According to prosecutors, her clinics applied those grafts to wounds that were already healed, infected, or ineligible for treatment, or to patients who had no qualifying wounds at all. And in some cases, hospice patients received grafts and then died within days later. Well, this you talk about a heartless and callous nurse practitioner, this Ms. Yukee. These people at the end of their lives and trying to preserve as much time as possible. And then this woman is putting allograft, these so-called amniotic wound allografts on individuals who don't even need them. You talk about callous, cold-hearted, and inhumane. And then how did the fraud work? The scheme had several layers to it. Ms. Yukee paid healthcare providers to refer patients to her clinics and separately received nearly $16 million in kickbacks from allograft distributors whose products she used. Listen to these numbers, all of them in the millions. In one documented case, she paid $1,600. This is one example. She paid $1,600 for a graft product and then directed her billing company to invoice Medicare for $3,900, more than double the actual cost. So she paid $1,600 for the graft, and then she billed Medicare $3,900 for it. This was her own cookie jar. The indictment also accuses Ms. Yukee of falsifying patients' records to make the treatments appear medically appropriate, and of instructing colleagues via email to inflate prices when seeking reimbursement from Medicare. She even put this in an email. Here you go with a digital technological footprint that will work in the prosecution's advantage. What was her lavish lifestyle? Every time these people are egregious, greedy, narcissistic, willing to cross the criminal line, it's all for material wealth and material things. Don't be a slave to this material world by willing to give up your moral and ethical mantra and chasing the bag by any means necessary will lead you into prison. So here's her lavish lifestyle. What did she spend the money on? A significant portion of the funds was used to support an extravagant lifestyle, including a multi-million-dollar home in Hawaii, an $865,000 Bulgari necklace, $865,000 Bulgari necklace. What are you going to do with $1 million necklace? Really? You talk about insecure at its highest level. She had a $594,000 Ferrari, 296 GTS, and she was developing a $4.6 million resort in Santa Ana, Cagayan, Philippines. So she was getting ready to develop a $4.6 million resort in the Philippines, where she's from. The assets valued at approximately, the assets that she had valued at approximately $35.2 million. That's what was seized as part of the investigation, including $467,000 in cash, 8 vehicles. One woman is going to drive 8 cars, and tons of jewelry. What were some of the prior warning signs in this particular case? Ms. Yukee was also sued in Nevada federal court last year by a company called Alerce Biologics, which accused her and her daughter, she even had her daughter involved in this case, of bilking this company out of $29 million in unpaid invoices. Allegedly, Ms. Yukee had sought a refund from the company after Medicare began denying her reimbursement claims. That lawsuit was withdrawn in February after the parties reached a private settlement. So what is the bigger picture? Ms. Marizel Yukee, a nurse practitioner, is just one of the 455 cases brought by the Justice Department as part of what is described as the largest healthcare fraud takedown in United States history. What an incredible story. Greed, the need for greed and chasing the bag by any means necessary will ultimately end you up in prison. The healthcare model is broken today. You go to the doctor, you see the physician once, and then after that, you see nurse practitioners, you see PAs, physician assistants. You don't even see the physician anymore. If you go to an urgent care or some of these other types of emergency facilities, you see a nurse practitioner right away. You don't even see a doctor. Where are all the doctors at today? So not only historically have doctors and administrators gone to jail for falsifying claims for Medicare. This is not something that's new, but you're seeing these other levels in the medical paradigm, like nurse practitioners owning businesses and laboratories, physician assistants that can write prescriptions in certain states and even kind of function as like a doctor. They are setting up companies and billing Medicare and Medicaid, and are getting their hand caught in the cookie jar filled with the need for greed. It's unfortunate. Tell me what you think. This has been the Trevor Donald Experience. Manifest your truth.